In this lesson, we'll be learning about the initial assessment in pediatric advanced life support. The AHA recommends following ABCDE when making your initial assessment: airway, breathing, circulation, disability, and exposure. When you're assessing the airway, there's 3 basic questions you should be asking yourself. 1. Is the airway open? When we say open, we mean unobstructed. If yes, proceed to check B for breathing. If no, ask yourself, can the airway be kept open manually? As in using either the jaw lift chin thrust method or the nasopharyngeal or oropharyngeal airway method. Lastly, is an advanced airway required? If so, you proceed to using an endotracheal intubation or even cricothrotomy if necessary. Next, check breathing. Is the victim's breathing too fast or too slow? Tachypnea has an extensive differential diagnosis, while bradypnea can be a sign of impending respiratory arrest. Is there increased respiratory effort? Signs of this include nasal flaring, rapid breathing, chest retractions, abdominal breathing, stridor, grunting, wheezing, and crackles. When checking circulation, check the pulse and blood pressure, the temperature, the skin color, and mucous membranes. Another way to check circulation is by bending the tip of the finger at the nail bed. This will determine whether the capillaries are perfusing efficiently. If it takes longer than 2 seconds, the skin and tissues are inadequately perfused, which indicates poor circulation. Here's an approximation of normal heart rates and blood pressures in children according to age. Your local guidelines may vary slightly, but approximate ranges are listed here. Feel free to pause it here to look at the table longer. Next, we have D for disability. This refers to the neurological assessment and responsiveness. There are 4 different stages that medical professionals go by to determine responsiveness. As long as the victim or patient is interactive, they are awake. While some may only be aroused by voices, others may only be aroused by induced pain. If you cannot get the patient to respond, he or she is considered unresponsive. This is a table of Glasgow's Coma Scale for infants and children. Once again, feel free to pause it here to take a look at it. Lastly, E is for exposure. Check for any obvious signs that may provide a clue as to the cause of the current problem, such as trauma, burns, and fractures. This concludes the initial assessment. Next, we'll look at diagnosing and treating after a second assessment. Thanks again for taking PALS with NHCPS.